Hi, Dr. Hamida, can you hear me?
Yes, I can hear you.
Awesome. We're going to start right away.
Amazing.
All right. And I just started the live stream as well. Okay, perfect. All right. Hi, everybody. Thank you for coming
Yes.
despite the Excellent. Thank you for coming despite the rain. It's so nice to see so many familiar faces and new faces who will be familiar soon. And this is our 9th teach-in. And I'm just really, really proud of the community we built together. This is a very special group of people, and I'm very thankful for you all for always showing up in person, which is, very rare these days. So thank you for coming here. You've done, you won half the battle by just being here. And if you already are here, then you know how dire the situation is, and you are aware of how these spaces can become very precious in a place like Harvard and a place like HMS. So thank you for making me feel safe, and thank you for being there for each other always. This is the 9th teach-in, but this is the first one where we're going to sort of expand the scope of the series to not just Gaza, but what's also happening in Sudan and what's happening in Yemen. And I know an hour or an hour and a half is not enough to really kind of scratch the surface of what's going on, but I'm hoping that these sort of series are going to help people be more engaged with the subject matter, normalize the discourse, be able to talk about it with friends, be able to talk about it in class, bring up the subject with no hesitation and no fear, most of all. I also know that there are other disasters, human-made disasters, that we're not going to be talking about, but I hope that in the next few months, we'll be able to sort of tackle many of these areas. We didn't talk about the Tigray massacre. We don't talk about the biggest refugee camp, the Rohingya. We don't talk about many things, and we should. And so today, I am really, really, really excited to host Dr. Anmar Humeida, who's the executive director of SAPA. It's someone that I have seen before speak online, lots of Zoom meetings, but I've never been able to actually talk to him directly. We were hoping to have you in person today, but we're going to make that happen because he happens to be in Boston, actually in Cambridge, right?
Yes,
Right?
exactly.
Yeah.
And I'm really so sorry for not being there in person. But
Not
many more times to come.
I'm sure, and I'm sure we're going to be hosting you again, because this half hour is definitely not enough to talk about how just complicated this topic is and how much suffering there is in Sudan and South Sudan. And so thank you for speaking to us today. I know your schedule is very busy, and we appreciate you. We appreciate your time. We appreciate all the work you've done and all the awareness that you've been raising around everybody around you. We need you, and so thank you for being here. And I'm not going to introduce him thoroughly. You have his bio in the emails, and I want to spend as much time listening to him and not talking about him. Thank you so much, Dr. Humeida. The floor is yours. I'm just going to make sure that once you share your screen, we can see it on the live stream. Do you mind
All right,
trying?
I'm going to share it. Yeah. I'm going to start sharing. But again, thank you so much, Noor, and thank you so much, Health Equity in Palestine group. It's been a pleasure just to be invited by you and to talk more about the crisis happening in Sudan, like anywhere else, unfortunately, in the Middle East right now and other different locations in Africa. The suffering of Sudanese people is unprecedented before, and unfortunately not properly highlighted for reasons that I'm gonna mention shortly. So my presentation gonna give you an overall view about the current situation in Sudan. Adding to that, also we will highlight a specific stories about the different health system demand that has been created out of this conflict, with a special emphasis on Khartoum state. And I'm gonna also mention why we will focus more on Khartoum state. But just to understand the aspects of the conflict itself in Sudan, this a war of misinformation and global negligence, and it's an intentional thing because of different proxy actors Unfortunately, some of them were friends of Sudan. They were called like friends of Sudan before. And unfortunately, also some of them, the Sudanese people were actually part of their prosperous future that only started in the previous century, the 20th century, and the last half of the 20th century. But unfortunately, they paid the Sudanese people paid the price of their growth by being the victims of their greedy mindsets to control the natural resources of Sudan, and also doing some sort of forced demographic change by the massive and unprecedented huge displacement crisis that is currently happening in Sudan. And the numbers were going to tell you why I'm saying this. So just to give you like a bit of historical background about the previous 4 years, which is directly linked to what I'm gonna just mention. This is like a paper that we published, me and one of my colleagues who were jointly working at the Federal Ministry of Health in Sudan, in the Planning and Policy Directorate, where we were actually hoping of a new prosperous future for the Sudanese people after we successfully removed Omar al-Bashir. But this war happened, and the history of the previous 4 years is directly linked to why we are currently facing the current crisis. So in December 2018, there was like massive protest against Omar al-Bashir, who was leading the National Party in Sudan, which is an Islamic regime, controlled the country with a fascist mindset for almost 30 years. This revolution was mainly fueled by the soul of young people whom tired of the control of the Islamic regime in a way that destroyed the country, destroyed the fabric of the country, fueled the aspects of discrimination against like specific ethnic groups, and also played with the aspects of divide and conquer in terms of utilizing the diversity of the Sudanese people, because Sudan has like more than 500 tribes, in a way that not actually making the country more attractive, because of its diversity, and utilizing the diversity element as a power element, but unfortunately has been weaponized against the Sudanese people by deviating them from the importance of focusing on the growth of the Sudan, and also shaking the aspects of national identity. So building on this movement in April 2019, the removal of Omar al-Bashir was successful, which is actually linked to the aspects of civil and elite parties, where we were hoping that those parties will gonna lead us to the safe zone that we really aim to see. So the young people of Sudan has actually supported those elite parties to be the fairest transitional government in Sudan after the success of the coup that happened against Omar al-Bashir because of this revolution in August 2019. Because of also like the greedy mindsets and also the political instability that was happening at that time, this transitional government have been re-elected again from the same parties to change like faces, and but also controlling the scene of political game, especially like during the transition, where you can see the fragile and unstable governance of the country affected the aspects of different infrastructure support, and also the sustainability of important services. I'm talking about also health, nutrition services, aspects related to the social protection schemes. Adding to that also, the COVID-19 pandemic made the situation worse due to the different complex situation that the country was facing at that time. The military leaders, I mean, whom are currently fighting the Sudan Armed Forces and Rapid Support Forces, decided to remove the assumedly selected transitional government as a civilian transitional government, in a way that took the trust from them because of the different political instability events that was happening at that time. But their solution was a radical fascist way that also repeated the same story that we were hoping that we will get rid out of it. I mean, after the removing of Omar al-Bashir. So this de facto government that came in October 2021 controlled the country until the hope that came also for the Sudanese people just 4 months before the war, when there was like some sort of agreement between the civil led parties together with the military leaders in something called like the political change framework agreement that was supposed to uh, bring the civilians to the governance bodies and to sovereign transitional government to the space of controlling the country itself. But unfortunately, this element was not actually fulfilled because of the proxy actors whom were having like different plans to dominate some of the military parties against the Sudan Armed Forces, which is the Rapid Support Forces, were supported by proxy actors. Those proxy actors supported this RSF militia to do a massive nationwide war that started in April 2023, which built, unfortunately, on ethnic cleansing, built on massive displacement for the people whom were actually living on those different locations in Sudan in a way that intentionally displacing them with other different tribes coming from the sub-Saharan Africa. So this crisis right now monitors like more than 11 million internally displaced people, which is a massive displacement crisis currently happening in the world. Yet you can't see something about it because it's intentional. The misinformation about the current crisis is intentional because of the main reason behind the displacement is changing the demographics of the Sudanese fabric. Um, More than 3.1 million actually crossed the borders to the nearby countries. More than 80% of the health facilities are currently not working. More than 25.6 million people are currently facing food insecurity. More than 24 million from the Sudanese people are currently in need of assistance. Adding to that, also the different like children death is quite underreported, but one of the studies that happened in Zamzam camp in Darfur state by MSF highlighted that 13 child dies daily in Darfur, North Darfur state right now because of the crisis happening. This also added to the different waves of displacements continue to happening because of the massive fueling of the war, not only in Khartoum, that started in Khartoum, but went to the southern parts of Sudan, of the new Sudan, I mean, in Sinjar State and Sinnar State, and now in Jazeera, with direct targeting of civilians and also affecting like the aspects of the different security related things and including the aspects of food availability and also the different violation that is currently happening because of the intentionally direct attacks against the people whom are living on relatively um, safe states, that what known as relatively safe states, but also have like different natural resources, including the agricultural schemes resources, to be controlled by other tribes. So because of this recent attack that was happening in Jazeera State, you might hear about it on the news right now. It's unfortunately affected more than 50 areas or neighborhoods in those states. On the 50 villages on those states, which also um, reflected by more than 100,000 people displaced from only Jazeera State during the previous 2 to 3 weeks, which is added to the overall number of displaced populations in Sudan to be more like 11 million, as I just mentioned, with more than 3 million refugees in nearby countries. And most of the displacement that was happening is actually in Khartoum. More than 33% of the people of Khartoum are actually displaced since April 2023, when the war started. This negligence also, you can see it in the fund that is available for Sudan. So the Sudan Humanitarian Response Plan is only calculated by like projected need for by $2.7 billion. Only almost like 50% of it actually secured, and you can see like the year is about to finish, which is also reflecting the aspects of the global negligence of the crisis currently happening in Sudan. You can see also like the aspects of the services availability. This is like the recent map from the UN OCHA about the different health organizations currently working in Sudan. It's only 46%, so 46 actors currently working in the different locations in Sudan. And you can see like the aspect of access to health is quite limited in more than 148 localities, and only covering 17 states. But in those 17 states, it's very limited accessibility to the services because of the broad spaces of those localities. Adding to that also because of the insecurity events that is happening in different regions. Especially right now, you can see like not many actors you can see, for example, in Sinai State, in Jazeera State, those states that I just mentioned right now, and they are facing the massive violations currently happening, and also in North Kordofan State, where you can see the RSF, the Rapid Support Forces, are actually right now currently practicing the forced weaponization of food insecurity and food inaccessibility and healthcare inaccessibility in a way that could force people to be displaced to the other eastern states, which is part of the overall plan of massively displacing the Sudanese populations in a way to replace them with other tribes. So just also to give you like overall picture of what's currently happening, of more than 11 million people has been displaced. The crisis added to the number of people whom has been displaced, the lack of accessibility to the basic necessities like food, water, medicine, and shelter. More than 70% of the health facilities is not working, and more than 3.7 million of those has been displaced and actually affected from the Sudanese people are wasted. I mean, children are wasted, with more than 700,000 of those children are facing acute severe malnutrition. 1/3 also of the population, including like 7.4 million children, lacks accessibility to water, while like 2/3 of those children lacks also the accessibility to the overall sanitation services. And more than 4.2 million women and girls are at risk of gender-based violence, with more than right now 400 events of recorded gender-based violence events has been identified at the different regions in Khartoum and in Jazeera State specifically. This also added to the limited, because of the different scenarios that I just mentioned, the limited accessibility to aid because of the violence and insecurity, which made the aid organizations not able to reach the vulnerable groups and worsening the crisis more. Adding to that also the economic strains because of the conflict and the displacement, which crippled the economy, which making it more harder for the people. And unfortunately, these different complex emergencies have been also more complicated by the heavy rain and flooding, which affected more than almost 1.5 million people. So just to give you like a quick analysis of what this conflict is currently doing to the people of Sudan. to give it like an overall look, the aspects that is linked to the health system and the aspect that is linked to the people. The direct aspect that is linked to the people is actually the physical trauma and direct injuries and death, physically disability that's happening because of the conflict, the mental health disorders, and the rape and the different sexual assaults that I just mentioned. And the indirect effects of this conflict that is directly affecting people because of the inaccessibility to health services is the aspects and food that is could be like summarizing the malnutrition, the increase in morbidity, worsening the chronic diseases conditions, the aspects linked to the stress and the worsening likelihood conditions, the different like because of the also the displacement, which complicating the financial insecurity related aspects, which is by default increasing the aspects of maternal and newborn mortalities and the different outbreaks and antimicrobial resistance. The direct effects that is linked to the health system is the disruption of different coordination mechanisms. I mean the interagency coordination mechanisms and the different platforms that's supposed to facilitate the aspects of health system resiliency, quote unquote. I'm talking about the health cluster as an example, which is unfortunately massively, let's say, weakened its coordination because of the lack of the inaccessibility of the aid workers and accessibility to information about what's currently happening in different regions in Sudan because of the lack of coverage to the basic health information system and surveillance system infrastructure. Adding to that also like the looting and the damage of health facilities and the shortage of medications and the shrinking of the physical space and the physical capacity for the country to support the system itself. The indirect reasons of collapsing the health system is reduced accessibility to health facilities, reduce the quality of healthcare, reduce the availability of health services in certain different locations that I just mentioned. Adding to that also increase the demand for services, especially like in different health zones, but in the relatively safe areas for people and to displace in. So right now, like more than 40 million people are struggling to access to healthcare because of this. This also added to the because of the flooding, the medicine shortage, and the attack on healthcare facilities. More than and also the events of the different displacement currently happening, and because of the huge displacement, the number has been because of the huge number that has been displaced. This unfortunately put more burden on the relatively safe states across Sudan to absorb the demands of those people whom have been recently displaced for them, especially like South Darfur, North Darfur, and Gaddafi state, because of the rising numbers of IDPs. This is also adding to the high levels of food insecurity and looming famine in different locations in where like people and aid workers can access because of the active conflicts and hostilities that's currently happening, especially in Al Jazeera state, in Darfur, in Khartoum state, and in Kordofan state. And also one of the famine zones that also uh, massively affected by this crisis are actually Zamzam Kam in North Darfur because of its relatively safe space land, like in Al Fashir state, which is like a center of active hostilities right now. A lot of IDPs currently move there, and this state, or this location, also affected by the inaccessibility of aid workers to provide supplies, including medicine and food, uh, which put people there at risk of famine. The healthcare attacks and the different like violation that's happening against healthcare cadre also complicated things more. Only WHO reported more than 100 attacks currently happening in this conflict since April 2023, with more than 188 deaths and more than 104 injuries. This is adding also to the aspects of looting the healthcare facilities and which complicated things more. Just give you like a glimpse about what outbreaks the country is currently facing. The major one is actually the cholera outbreak and the dengue fever outbreaks, with more than 28,000 cases of cholera outbreak and more than 800 deaths across 11 states. And those 11 states are actually the accessible states for health workers and surveillance system personnel to identify the cases, either through syndromic approach or through the laboratory services. Adding to that, also more than 5,000 cases of dengue fever has been identified. The country has been declared against the IHR, the International Health Regulations, in August 2024 as a cholera outbreak country. There is also availability of vaccine, of cholera vaccine, but it's only accessible in 7 states. More than also 2 million babies born during this conflict are in the face of hunger, according to the Save the Children, with malnourished mothers increased risk of neonatal mortality and poor health outcomes. Unfortunately, this also, as I just mentioned, complicated by the floods, and the floods really also like made the situation of food insecurity a way more worse. So just to give you like a glimpse about the international phase classification of food insecurity, most of the country is currently in level 3 and level 4, which is crisis and emergency situation. And you can see the spots of emergency situation are currently located are areas where you can see active hostilities and also like inaccessibility of aid workers to provide services, which is also put those areas at risk of famine. You can see like more than 12 locations are currently identified as a risk of famine location, but yet unfortunately not declared because of, I believe, also political reasons, because no one knows actually how those people are currently affected by this conflict, because there is no like accessible information about them. And this also part of dehumanizing the people of Sudan by providing lack of information related aspects and miscommunicating the situation of those people, especially in those hot spots that I just currently shared. So just also to highlight the aspects of the humanitarian response, it's currently achieved like around like more than 12 people has been reached with like services, including the FSL cluster reach around 90 services with food and livelihood support, which is but it's quite like questionable because like looking at the different aspects of the inaccessibility that is currently happening, hindering the trust of those numbers. One of the success stories that is also happening in Sudan is the rollout of the malaria vaccine, which was a historic event for the people in Sudan. Looking at the different challenges that we are currently facing, is still the country managed to secure more than 3.4 million vaccine to be provided, violets to be provided across the Sudan. One of the reports that SAPA actually recently published together with the London School of Tropical Medicine and Hygiene is linked to the aspects of capturing the real numbers of the people died because of this conflict. Because if you just Google right now the conflict in Sudan, you can see up to only 15,000 people have been died because of this conflict, which is unfortunately not true. So one of our trials was actually like doing like some sort of scientific methods to communicating like those numbers in a way that somehow could be like close to the reality of the disastrous situation that was happening, especially in Khartoum state. So the research methodology that we utilize is capture analysis, using the different public and private surveys, the social media, obituaries, and also focusing on Khartoum due to the limitation of data in the different locations, especially, for example, in Jazeera, Sinnar, and Sinjar. So only in Khartoum state, the study estimated more than 60,000 total deaths happen in Khartoum state and 50% increase from the pre-war rates, and over 26,000 violent deaths in Khartoum, exceeding the national report, with 90% of deaths unfortunately underreported. And this also led to a nationwide preventable diseases and starvation related incidents. Adding to that, also the violence was highest in Kordofan state and especially the North Kordofan state that I just shared or showed you previously. Adding to that, also Darfur. There are three events of ethnic cleansing actually happening in Darfur and Kordofan. Also, the regional disparities across Sudan because of the war and also because of the controlling parties. You can see the disparities are actually huge in areas where the RSF or the Rapid Support Forces are controlling the scene because of its ethnic-related mindset and also the aspects of the major displacement crisis that they want to create because of the intentionally demographic change that they want to see in the country. So the major implications are actually that we really communicated through this report is to scale up the humanitarian response and to provide mechanisms for humanitarian rights accountability, and also including the aspects of vigorous diplomatic efforts to end this conflict and put those two conflict parties accountable. So this is also one of the quotes that we really I wanted to highlight with you is actually reflected by Dr. Maysoon Dahab. She's assistant professor at Langdor School, where she said our findings reveal the severe and largely invisible impact of the war, particularly preventable disease and starvation, which requiring urgent action. One of our also recent efforts, and I'm really so sorry if I'm taking so much, Noor, stop me at any moment because the presentation is quite dense. So one of the report that we just also finalized with Yale Humanitarian Lab, it's gonna soon be published in December 3rd, is actually highlighting the aspects of hospital damage that happen only in Khartoum state. So this study actually conducted by us at SAPA and Yale Humanitarian Lab, which actually focusing on assessing the damage to the hospital infrastructure in Khartoum state because of this conflict. And the methodology that we use is cross-reference analysis, utilizing the local experts in sites, adding to that also the open source data and the satellite imagery. What we found is more than 47% of the hospitals in Khartoum were actually directly damaged in the first 500 days of the conflict. I mean, specifically between the period of April to 15th to August 26th. And the damage affected at least, and this actually number we estimated based on the catchment area of those different hospitals. This number directly affected more than 700,000 people to access health services, and which is 1/3 of the total catchment area estimated only for Khartoum state, which is more than 2 million patients. So the implications are actually disastrous in terms of accessibility to healthcare, and which massively affected the aspects of public health security measures in Sudan. And it has a long-term and short-term risk to the population health due to the persistent attacks also currently happening on those hospitals, because we recorded most of those hospitals are actually not only attacked at once, but also in different periods throughout this 500 days of the conflict. And we also captured a lot of hospitals were actually located in relatively now safe states, has been its infrastructure has been supported by local efforts, but unfortunately it has been attacked again, which made the situation way worse. So it's also increased the aspects of the threat that is directly affecting the healthcare and emergency medical services across Khartoum state and Jazeera state. And the importance of Khartoum state is actually not, the Khartoum hospitals are actually not covering only this state, but because most of the health system in Sudan, especially the specialized care, was actually centered in the capital of Sudan, which is Khartoum, which massively affected the aspects of accessibility, especially for specialized care for rare diseases and other related chronic diseases in a way that um, unprecedented before. And one of the main conclusions that we came out of this report is the urgent need for protection of healthcare infrastructures, and also the importance of coordinated humanitarian efforts to address the immediate and future healthcare challenges, which is really important not to focus only on the humanitarian interventions, but also understanding the implications of not uh, rebuilding, the aspects of the health system fabric currently disrupted in Sudan, and always thinking in an access approach, not only providing humanitarian interventions, but also adding the development element that could also facilitate the aspects of achieving peace. I just wanted to conclude by stories of resilience from our teams on the ground. This is like a picture of one of our medical teams. His name is Mudassir. He is actually living in Red Sea, which is one of the states that has been affected by the floods in August 2024. He actually decided to move and swam through the flooded areas to reach the hospital that he was providing care at, which has demonstrated a remarkable dedication amongst this crisis. One of the stories also I wanted to highlight is from one of our medical providers in Khartoum, where he decided not to leave his patients in a Bullock hospital, which is supporting mainly children, and it has like one of the biggest right now malnutrition wards, which we call them stabilization centers, currently work in Khartoum. This hospital is receiving more than 30,000 patients right now because of the displacement. The catchment area of the hospital has been massively shifted. But this doctor, especially on the first days of the conflict, refused to leave, and he said that I can't leave my patients behind. This is also one of the stories that we really proud of. In the early days of the war, in the Bullock hospital that I just mentioned, in the middle of the crossfire between the bullets and missiles, yet a doctor and a nurse and a guard did not leave the hospital and kept serving children under these inhumane circumstances. His name is Ahmed. Unfortunately, days into the conflict, they lost the guard because he killed in a crossfire. But they remain working in the hospital, supporting its operation for the children whom were serving at this hospital. This is also one of the beloved success story that we really aim for you to see. This child, his name is Qais. He came actually from Jazeera state with severe acute malnutrition, as you just see. And this is the result of our teams whom were supporting his care throughout like more than 30 days. And we really love to see like that he's crying, yet he's healthy. And yeah, thank you so much again for the opportunity to talk to you today. And this is also like supporting the aspects of increasing um, the development and rehabilitation efforts for different hospitals in Khartoum. This is one of the projects that we are currently supporting. This hospital, it's called the Saudi Hospital, is supporting maternal care and neonatal care, where we are currently rehabilitating it with a cost of more than $400,000. Yep. Thank you so much again for your listening.
Thank you, Dr. Humaida.
And you?
No, you are muted.
me now?
Amazing.
Yeah? Okay, sweet. Thank you so much, Dr. Hamida, for putting this together, for all the work that you've done. I think I can speak for not just myself, but everybody here that we have the deepest respect for people who are shedding light on this issue. There's no amount of there's no way we can like talk enough about this. So thank you for amplifying the voices of your patients, of your colleagues, of the humanitarian aid workers who are putting their lives on the line, and all the Sudanese people who are caught in the crossfire. I also wanted to thank you for the research that you've done. I know it's not, a lot of it is not published yet, but these numbers are horrifying, and I think what's even more horrifying is the amount of underreporting. And I hope this inspires some of the students here to sort of maybe ignite an interest in this realm of research, which is how important it is to publish about these things, not only to memorialize these issues and these numbers, but to also avoid this sort of catastrophe from happening again. And then the other thing I wanted to really commend you for and thank you for is to frame this in the political context. I think it's important for us to really have like a robust knowledge of what's going on, of the political parties who are involved in this, of the foreign powers who are involved in this. A lot of people think that this is a new conflict or a new issue, but it's not. It started a long time ago. And thank you for framing it that way, because that's definitely a really important knowledge to have in order for us to speak firmly and really confidently about the subject matter. So thank you. I'm sure a lot of people have a lot of questions, but we're going to leave that for the end. And we're going to move to Dr. Muharib.
Sure.
Yeah.
Can Dr. Anwar, can you stay to the end? Because
Of course, I'm gonna be here.
Yeah. Okay, good.
And I'm really so sorry. I feel like I took so much. I was.
No, don't apologize.
No. I wish we could actually. I wish we could give you more time to speak about this. There isn't enough. That you probably can say.
But why I put like so much effort for you to understand the context, because most of the people actually didn't get like the conflict in Sudan quite well.
I absolutely agree with you. I think we definitely don't talk about it. And you have mentioned some of the reasons why. Lots of it are really based on really unethical reasons and really problematic things. But I'm hoping we can maybe discuss those issues in a bit after Dr. Muharib's presentation. Can I make you host?
Okay, great.
Yeah? I'm gonna make you co-host.
What do I do?
And you just have to share your screen. Yeah.
Okay.
And Dr. Hamida, let us know if there's any issue with the sound, because if you can't hear it, then people on the live stream also can't hear it. So let us know.
No, the voice is quite amazing right now. Thank you so much.
Should I get up? Or should I stay here? Yeah. Okay. Are you guys okay if I stay seated? Yeah. Okay, good.
Would you mind putting your camera on?
Oh, yeah, that's a good idea. Yeah. Oh, yeah. I want you to go out loud. Yeah, that was good. Dr. Almeida, I'm so humbled to follow you. I saw you speak at our pediatric grand rounds last year in December. It was also very compelling, where you spoke about children in the conflict. So thank you.
Yeah, thank you so much. And I'm really glad you were there. Amazing.
Yes, of course. I was with the Web, my friend, so I know you know him. Yeah.
Yeah, exactly. Awab is a very close friend of mine.
Likewise. Okay. Do you want me to unmute? Will that make a problem if I unmute? Okay. Hi, everyone. Hi. So my name is Amir. I'm one of the infectious disease doctors, and I'm based at Mass General. I thought it would be a small group, and we'd be able to go around, and I would meet all of you. It might be a little tough now. How are you? You want to come give this talk? Yeah. Okay.
She actually gave one last year.
Oh, you did? Okay, well, I just
Yeah.
got back from Palestine, so she could give this talk better than me. Of course. Okay, so I'm based at Mass General. I'm based at the MGH Center for Global Health. I'm an infectious disease doctor. I direct a group that does research on infectious disease outbreaks related to refugees and migration and humanitarian emergencies. So I'll be very, very quick because I think it's actually more interesting for us to talk to Dr. Homeida, and now that Roa is there, I'll put you on the spot, and anyone else I see maybe. So I'll be very, very quick. I'll talk about like two conflicts where we've done a little bit of work. One in Yemen, and then of course we'll talk about Gaza. But there's a definition: complex humanitarian emergency. This is a little bit different than a typical public health emergency or crisis. A complex humanitarian emergency refers to when the infrastructure for kind of social well-being and governance breaks down, and those are the source of not just extreme levels of displacement, but also what I'm interested in, which is infectious disease outbreaks that result from that. Let me see. I might have shared the wrong screen here. Let me just make sure I have the right one for you guys. Okay, yeah, I think this is the right one. Okay, apologies. Yeah. I said this is like watching one of your grandparents share their Zoom. Sorry. Okay, there we go. I'm not that old, I swear. Okay. Yeah, so we'll talk about a couple of things. So we'll talk about this one thing that I've called syndemics. If some of you may have heard about it, we'll talk about it in the context of war, and then also this is what Paul Farmer used to write about, is calling structural violence. And then I'll give these two examples, one of Yemen and then Gaza. So the syndemics framework, this is just something that's used to discuss the interaction between diseases and then social and environmental factors that work synergistically. So it's like synergistic epidemics. That's what it's about. It was originally described actually in New England and Connecticut back in the I think like early 1990s, to talk about how people with substance use disorder, maybe they're subjected to sexual violence. There's a problem with injection drug use, and then HIV, and then each one of those things can make the other ones worse. And so this is what we think about for syndemics. And there's a lot of different ways that syndemics can work. We often also have this other concept called structural violence, which I think is very, very similar. And some of you probably have read about that if you've read work by Paul Farmer. And so now, so this is my addition to this is a conflict syndemic. So I coined this term. So especially with war with lots of displacement, I would love to hear all of your thoughts on this. There's this sort of similar synergistic interaction. You get malnutrition because you could have either blockades or siege, or you have chronic underdevelopment, climate change. But then that also is related to diarrheal outbreaks or other infectious disease outbreaks that can worsen displacement or could complicate displacement. But displacement itself can kind of synergistically aggravate these outbreaks. Aerial bombing can kind of cause displacement, and then war itself as sort of like an underlying cause of facilitating these more kind of chronic issues. So that's what I kind of coin conflict syndemic. So and then I think at center of this, we have advanced pretty well, just healthcare, our knowledge of sanitation and hygiene, our knowledge of our ability to vaccinate against a lot of really, really deadless outbreaks. And so it is really when kind of healthcare infrastructure and healthcare personnel are targeted as well, that you see these really large outbreaks, very like what Dr. Hamed described in Sudan. And so I think there is a level that kind of medical science and most countries, even fairly underdeveloped countries, healthcare systems can withstand, even with war, malnutrition, or displacement. But then, there's some level of underdevelopment. And then, of course, the targeting of healthcare workers or the flight of healthcare workers can result in these larger outbreaks. So, okay, so we'll talk about Yemen. So you guys maybe know a little bit about Yemen. This is a country in a really kind of important strategic part of the Gulf. It's a beautiful country. I've had, I don't think I included it in this slide, shame on me, but I have a colleague of mine who, whenever she talks about Yemen, she includes this really gorgeous, beautiful picture of Sana'a, the capital, to sort of remind us how beautiful and ancient. It's one of the oldest continually inhabited cities in the world. And so there's a little context for the war in Yemen. In 2011, like many parts of the region, there were protests and desire for a transition of power. The autocrat who was ruling Yemen for the longest time was basically had a transition of power, and there was a promise that there would be, from this transitional government, a new constitution and elections. That ultimately didn't happen for a variety of reasons, and in 2014 there was frustration with that transition process. A number of dissident groups rebelled and overtook the federal government in Sana'a, and that's where the country basically got divided into what is commonly, I think maybe inappropriately called a rebel government in the north, and then the legacy government ruling through much of the south. And then in March 2015 until basically now, but it's until 2022, there's been kind of aerial bombardment, siege, and land warfare perpetrated by a group of U.S.-supported coalition states, mostly in the Gulf. This is a map just in 2019 to show you how the divided the country was. And there's a much deeper history to go into. And if anyone is here who wants to speak to that, that would maybe be good at the end. But I'll talk about just a couple of things first. This is the capital of Yemen. This is Sana'a. This is the beautiful city, which I'll next time I give this talk, I'll include that same photo. And then here's the airport for the city. And this is zooming in on the airport as well. And the thing I'll highlight here is that this is the city's main water treatment facility here. So this is a picture of it. And one of the first things that were bombed when the bombing started in March of 2015 was the airport, because they wanted to make sure that the kind of new government didn't sub weapons or whatever you want, so it's a strategic on the airport. And then the next month they bombed the central electricity grid, which put this water treatment facility out of commission. And the workers there were able to still keep it running, actually, by switching it from its central electricity grid to a fuel generated electricity. They had a backup generator that depended on fuel, and so then they kept it running. But then from May to June of 2015, there was a blockade of the kind of ports in Yemen, and that resulted in there being less fuel available. So then they kind of eventually had it running only like 12 hours a day, then like 4 hours a day, and then a year later, we many of you probably already know how the story ends. There was a cholera outbreak in Yemen, and so this is the cholera outbreak in October 2016, and then it skyrocketed in 2017. This ended up becoming the largest cholera outbreak in recorded history, and there's a lot of kind of reasons suspected of that. So more than 2 million total suspected cases up to 2020. This is a really incredible outbreak, and this is it in comparison to other outbreaks over the years. There was cholera in Yemen before this, so there was sort of so that's why it kind of like took hold, because it was there already. And then let me see if I had that here. Yeah. Yes, that's right. Okay. This is that other component I had mentioned. Hundreds of attacks on hospitals and clinics, including makeshift cholera treatment facilities that were set up, especially in the north. There were other civilian targets that were just quite obviously attacked with high altitude aerial bombardments. And then of course this naval blockade kind of kept the country or kept people internally displaced without actually being able to escape. This is the cholera cases by governorate, and just a very simple study that showed that places that were subjected to aerial bombing from this U.S. supported coalition were the ones that these are the governorates that had the highest reported levels of cholera. And so that's kind of a no-brainer, but a really simple way that research can draw inferences about why these events are happening. And they also had the highest amount of deaths, so they had a disproportionate amount of deaths. Overall, the deaths from cholera in the outbreak in Yemen was much lower than in other outbreaks in the past. but they had a disproportionate share of the deaths. And that's related to malnutrition and ability to get treatment and so on. There's another thing about Yemen that I would like to share, which is the FSO Safar. Does anybody know what the Safar is? Anybody heard about this? This is a ship off the coast of Yemen, and so this is a picture of Yemen. It borders the narrowest part of the Red Sea, which is the outside of the canal, which is the Bab el-Mandeb Strait right here. So this is a really, really critical part of the Red Sea. And the Safar is was this oil tanker that was permanently moored off the coast of Yemen. It had more than 1.1 million barrels of oil, and it was rendered out of class since 2016. So basically, it was made in the 1970s. It was like a big ship full of rust, and it was breaking down and full of oil. And because of the war, there was obviously a big conflict about who owned that oil, who controlled the Safar, and the government that took hold in the north took hold of the Safar and obviously wanted the resources from it. And this was like a disaster waiting to happen. There were all these negotiations about trying to unload the oil in the tanker. If it spilled, it would have been many times the size of the Exxon Valdez oil spill, which was one of the kind of most devastating, environmentally devastating oil spills in recorded history, in recent history, I should say. And then I remember I think it must have been 2018 or 2019, there was a fire in the tanker of the ship, which everyone thought would result in a spill, but it was diffused. And so I worked with a group, and particularly this kind of first author who was an incredible statistician, to try to model what would happen when the Safar spilled, like what would happen to the surrounding region, what would happen environmentally, what would happen in Yemen itself. And we used made this environmental model of an oil spill, parameterized it with the type of oil that was on the tanker, and then also the what time of year a spill could happen. If it happened in the fall or the winter or the summer, it would spill in a different way. And then try to kind of determine what would be the public health effects of a spill like this, either with hospitalizations from air pollution or restrictions in the kind of ports in Yemen. And I only bring this up because this is maybe like the only kind of piece of good news that I've ever had come out of any of our research. But because of this, and I would really say Ben's work on it, they reconvened talks with a lot of the Red Sea countries about unloading the Safar, and we realized that many of the other countries in the region had assumed that something about that the oil in the Safar was being dealt with, or that they had come to a resolution, or they underestimated the impact of it. And so, thankfully, about a year ago, they actually did a ship-to-ship transfer of all of the oil on the FSO Safar, and so, amidst all of the other tragedies of this crisis, at least that one was averted. The beauty about it, for those who are interested in public health, this is like a typical public health project where it sort of averts an event that no one would have ever known could have happened, but would have been extremely devastating if it would have happened. Okay, that's Yemen. Those are like some 2 case studies there. And then in Gaza, I'm sure most of you know about this, so I'll be very, very quick so we could actually have a conversation. But as most of you know, Gaza Strip is a densely populated strip of land, 2.2 million people, the vast majority of whom are refugees from other parts of historic Palestine. Since 2007, it's been under a naval land blockade, and then obviously since October of last year, it's been under what the ICJ calls a plausible genocide. One of the deadliest concentrations of a war that we've had since the Rwandan genocide, in terms of just deaths of people in the first 100 days. This is data as of last spring, but it's stayed true. And then also the highest concentration of child deaths among all of these recent wars. It's really stood out in just the concentration of people who have been killed in such a short period of time. a part that some colleagues and I are particularly interested in the destruction of water infrastructure because it has a lot of similarities to the conflict in Yemen. Like Yemen, it's more of a captive population rather than an externally displaced population. So there were very few like international refugees from Yemen. Most of them were internally displaced. And the same thing with Gaza, almost the entire population is internally displaced. And then Gaza, by the nature of the blockade, really depended on Israel for its clean water. So a minority of that water was actually shipped in through tunnels, and there's an Israeli company, a single Israeli company that kind of controls those tunnels, and that was just turned off flat out the first week of the war last October. And then the rest of the water in Gaza comes from basically requires desalination, and that requires steady access to fuel and energy, which has also been blockaded. And then so that's the problem with it. So essentially, since the beginning of the war, there was no potable water, and people, Palestinian physicians have been reporting that dirty water was used in formula for babies. Dirty water was being used in the hospitals. A surgeon who was working there told me that they were basically having to wash their hands with saline because they had no clean water for some parts of the conflict. And then so that's the water coming in, and then also it's the wastewater being treated was also damaged. So this is one of the largest wastewater treatment plants in the north of the country. This is in October, and then in January, and you can see it relied on what these are like solar panels over here, and they were almost mostly destroyed. And so that was around the time that these are all satellite images, obviously, when this plant went out of service. And if you see any photographs from Gaza, you could see all of these pictures of people trying to avoid puddles of wastewater and such. And then in addition to that, obviously, I think you all probably know the story of virtually every hospital was either attacked or rendered off of commission. I think at the latest, it's only some field hospitals, and then maybe a dozen or so partially functioning hospitals. More than 1,000 separate attacks have been recorded. The health ministry in Gaza released just a couple of weeks ago a documentation kind of report about all of these attacks. More than 1,000 healthcare professionals have been killed. More than 300 arrested and detained, and at least 3 physicians died while under detention. So some of you may have seen this collaboration between the Hopkins Center for Humanitarian Health and the London School of Hygiene and Tropical Medicine, where last February they did their first report of evaluating these scenarios of either ceasefire, status quo, or escalation, where they reported projected on like what would neonatal and maternal mortality look like, what would severe acute malnutrition look like under these scenarios, and then what would infections of epidemic potential look like. Even at that point, there were outbreaks of meningococcal meningitis. We haven't had a reported case of cholera there. There was one in Lebanon, but not in Gaza yet. And then obviously many of you probably know that there was polio disease discovered over the summer, and I'd be happy to talk to you a little bit about polio if that's of interest to the group. But they've submitted a second round of these projections if anyone is interested. The other main thing is hepatitis A, which is fecal, or more than 100,000 cases of acute jaundice, which is presumed to be from hepatitis A since last October. Again, one of the doctors I know who's working in the hospital there said basically every child had yellow eyes in the hospital, even the ones who were there to visit or be with their family members. The causes of this is overcrowding, displacement, the destruction of the water infrastructure, like I mentioned, and then an interruption in vaccination. And there's many other conditions to talk about: viral respiratory diseases, meningitis, diarrhea, and then polio is a unique entity that we could talk about as well. I don't want to. I think maybe it might be more useful for us to have a conversation though. And then of course I'd love to, Dr. Hameda, if you're still there, talk to you about some of the work that you all have done there. So thank you all for the attention. if no one has a question, maybe I'll call on Roa to give her perspective. Oh, but you already spoke to the group, huh? Okay, okay, I didn't hear it.
Oh, so we're doing questions then?
Are we
We
doing
can,
questions? What
yeah,
are doing?
we can you hear us well, Dr. Hamida?
Yes,
You can, okay, perfect.
amazing.
Um,
And thank you so
thank
much,
you.
Dr. Mahar, for the
Yeah.
nice presentation. Yeah.
Oh, my pleasure.
Oh, it's a,
Would
it's a
you
comment.
It's a would you mind using the mic so that Dr. Hamida can hear as well?
quite loud, but
And
okay.
and maybe turn it
It's
on.
okay.
Oh.
Unmarked. People on Zoom.
Look, is it? I think it's on. Hello?
No.
Yeah,
no, it's
Oh, okay.
I'm not a Harvard affiliate, so I just want to clarify, but I'm a trained medical anthropologist and historian, and we quite don't like Paul Farmer where I'm from, but I recognize that this is his domain. And actually, Partners in Health is one of the very few organizations that's not yet officially called for a ceasefire. But there's a reason I'm bringing this up. So I've actually, I don't know, Dr. Hamida, if you know about Sunduk Sudan, but there was this wonderful event that I went with this mutual aid group in Sudan. And these were local activists who are actually pushing against aid agencies and their presence in Sudan, not because they don't want them there. They obviously want humanitarian aid, but they were saying that many of these groups directly hinder our revolutionary, our political messages, and they also don't listen to us. And so we have a UN agency come in, and they completely derail our own mutual aid fund delivery. We are the doctors, we know what we're doing. And this is sort of a long-winded way to kind of tie both talks, but it made me think about kind of citing structural violence, citing Paul Farmer. People do this, especially in aid work, but in reality, we've sort of moved past that in the sense that structural violence now, and I say this as someone who's in aid delivery and humanitarian assistance, is that like, it actually obscures the political. And so Sudan is the perfect case, Gaza is the perfect case, that it doesn't actually lend to accusations and political accusations. It lends to this kind of elusive actor, right? And even in the talk, we use passive voice. This is public health, and we're still not willing to kind of indict groups that are responsible. And so this is just a comment, but also it's an open conversation, because I think the question is that we always have as academics, as doctors, as aid workers, is how do we not become a professionalized class that operates from this neutrality, because it's a fiction. And I actually think that maybe, and hope maybe Dr. Hamida can speak to this, is maybe it is about mutual aids. Maybe it is about moving away from this aid paradigm that we have to, you know, to empower local actors who are also heavily political. But yeah, I would love to open the conversation, but also comments and whatnot.
Thank you so much. Thank you so much for highlighting this. You know, I didn't plan to talk more about like to focus my talk about like what currently SAPA is doing. I mean, the Sudanese American Physician Association is doing, but you are describing exactly what we are currently actively advocate for. So there are like two main important angles that I just wanted to mention. The creation of SAPA itself was actually built on pro-democracy movement that was happening like during the revolution that I just mentioned. And this mandate has been massively shifted after this war. It became like focusing more on the aspects of humanitarian response. And the approach that we are utilizing is directly linked on mobilizing local actors. I mean, those different medical providers whom were our colleagues and friends before this war, and unfortunately forced to stay in different war zones to be empowered. And this is what you were just mentioning, the aspects of decolonizing global health support as much as we can in a practical manner. So most of the resources that we are currently utilizing is not a UN fund. It's basically linked to flexible financing mechanisms that is linked to the diaspora groups, adding to that also the like different like innovative approaches of funding your humanitarian response on the ground, including the utilization of different, for example, digital fundraising platforms. So mixing this approach with what's so-called like UN-based or bilateral donors interventions or support for the different services that we are currently providing in Sudan, empowered us in a way that gave us like more flexibility and more agile and real-time response to the different like outbreaks, for example, or different violence attack that needs like medical support and accessibility to health services. One of the locations that I just mentioned is Jazeera State. If you search about this state right now, you can see unprecedented violence happening against the people of those like villages right now. I'm talking about like more than more than 90 villages right now affected by this recent attacks. But in the middle of those attacks, we are currently providing services in one of the affected locations, which is what the UN and other humanitarian actors failed to do. And this gave us like some sort of autonomy in terms of providing the services that we really aim to see, but also put us in a more pressure, let's say, for the people of Sudan to jump at any emergency, looking at the limited resources that we have. So what I just wanted to add on this is, future medical providers, future doctors must understand, health is political, unfortunately, and you must act on it this way. And the evidence that you are generating out of the, let's say, the different like scientific researches, it's a very strong advocacy tool to put people accountable. Not only, by the way, the direct like conflict parties, but also the proxy actors to the violation that are currently supporting, and the amount of people that we are losing out of their power dynamics and different interactions that are currently playing with to dominate like X or Y country. So the aspects of localizing the aid is important, and this is also one of the SAPA's activity that we are currently part of, which is called the Local Coordination Council. It's containing a lot of civil society organizations currently working in Sudan, and the main aim of this coordination mechanism is, I don't want to say to replace, but to synergize the gap that, or to support the gap that other like UN-related coordination mechanisms fail to do. Adding to that also, providing more information to those international actors to be well informed, and also to put them accountable to the crisis that they are missing. Thank you so much.
So I'm Dr. Mina Aladdin. I'm a toxicologist by both training and profession. I'm also an MPH student here. So number one, Harvard, first of all, it's an elitist institution by every measure, but also there's a pathological avoidance to talk about anything controversial because it might step on someone's sentiments. And it's even in public health, and I'm so bloody ashamed. I'm really, really ashamed of my colleagues, because at best you get pathological avoidance, and at worst you get censorship. And I can't believe it. I'm actually disgusted, and most times. So that's number one. And this is sort of airing my grievances. The next thing that I did take a class in social medicine on Palestine and Jordan this past summer. I think you actually cited Brahm's paper. It was Brahm and et al. Who had led this wonderful course, and I think like there was a lot of jousting between us and you and UNRWA and all of these other organizations, and a lot of these organizations, and they say that we have to maintain neutrality, like this very, very difficult stance of neutrality, so that we can maintain our funding. Otherwise, we will not have UNRWA function. We will not have these systems going in and providing aid. it is very difficult because I think a lot of this, especially displaced Palestinians, do claim UNRWA as theirs. They rely on it on so many different levels. But at the same time, it's like, at what point do we say that it is sort of ethical to take a political stance as the only ethical thing to do, but at the same time, if we lose funding, we will also millions of people will lose aid. So that's number one. But then there was the other issue of not even just like maintaining neutrality, but so those are things sort of I am thinking critically of, that these systems also maintain this stark dependence, and they maintain the status quo of like emergency medicine in a humanitarian crisis. So I'm just sort of wondering, it is not right now plausible to say we have to dismantle everything right now because we are in a legitimate humanitarian crisis. But in terms of us decolonizing medicine, we really have to get at the root of this and actually, stop making people dependent on it. And it's like, how do we do that? How do we rebirth a new system where people are becoming self-sufficient? We've never allowed Palestinians and Gazans to do that. They were under blockade, so they've always relied on external aid. So I think it's a matter of tiptoeing around the status quo, but now under immense pressure, which we've never seen before, because it is getting decimated every fucking day. I don't understand how we would decolonize medicine now, but it does need to be addressed. And I don't know at what point or what venture, if we're going to get a ceasefire, and what's that going to look like when we sort of start rebuilding Gaza and how we make it self-sufficient. And they are self-sufficient. They're brilliant people. Yeah, that's all I had to say.
Hello? Okay. Hi, I'm Nora. Nice to meet everyone, and thank you so much for everything that you guys have all said here and on Zoom as well. So I just wanted to ask, because a lot of us are starting our healthcare profession, and I'm not sure about any of what your parents have said to you, but my parents have been like, please don't talk about this. I don't shut up about it because I can't. I feel like I can't, but how can we use our voice, but also in a strategic way? Because as you said, neutrality, you have to do it in order to secure funding, but what can we do? But then, also work as a community so that we aren't doxxed, and that we are, we don't have this looming fear above our heads, because what we've been saying, it just feels so what's the point of Harvard if we just are talking about social determinants, inequities, except genocide? It's diversity inclusion until it comes to our people. So I just don't know what to do every day, because a part of me is protect yourself, but then it's at the same time, who am I to say protect myself when so many of these things are happening? And I know it's gotten better over this year. I think in the sense of people speaking out, it's been a little bit better. But what can we do, especially as we're developing our profession? Which is a very loaded question.
Hi, everyone. Thank you so much for the amazing presentation. It was very informative. I myself learned a lot. Thank you for shedding the light on Sudan and Yemen. I do realize that in comparison to what's happening in Palestine, these two countries haven't been getting much attention. And it's something that I myself feel guilty about. I always feel like I need to be more educated. I need to do more. So I like that we're bringing these issues and we're creating these spaces to discuss and share knowledge about what we do, and also discuss what we can all do together. I think in response to your question, so as a bit of a background, my name is Ru'a Rimawi. I'm a physician and I was trained in Palestine. I moved here just a year ago. So I was born and raised in the West Bank. And to me as a Palestinian, just being in these spaces in which we all feel safe enough to actually share about our thoughts and ideas without any kind of censorship, and to feel this kind of solidarity, it just empowers me. It empowers me to speak my truth. It empowers me to address things Yeah. Sorry. Yeah, it just empowers me to address things the way they should be addressed. And I think one of the things that we always need to be aware of when it comes to global health is not to let anyone else speak up on behalf of us. It has always to come from us, the locals, the people from the region. And as you can see here, like Dr. Amir Muharib, Egyptian, Dr. Humaida, Sudanese, and they're the best people positioned to actually talk about this region. I feel like when it comes to the Middle East, we've always had people maybe with the best intentions, honestly, with the best intentions, but they don't have full understanding of the situation and the complexity of the situation that might not make them the best people to actually talk about it. So I think it is important to just centralize the voices of the people coming from the region because they are the most qualified people to actually talk about it. And I think the best way to avoid censorship will always exist. But one of the things that warms my heart is to look at the amazing progress that we have made. Like, I don't think that these spaces, sorry. Okay. Yeah, I think we are like to just acknowledge the progress that we are making, to acknowledge, I know that it's easy to feel helpless amidst everything that is happening. It's easy to be consumed by this negativity. It's easy to be convinced that there's nothing to be done, but this is what they want us to be convinced, right? They want us to feel like there's nothing to be done, but there has never been a radical change that did not start from where we are starting now. And we are doing a progress, just creating these spaces, being together, always coming up with ways to shed light on what's happening, documenting what's happening, publishing research about what's happening, and hopefully soon enough, we're gonna move to the phase in which we start implementing changes based on the evidence that we have been sharing and publishing. I think one final thing that I wanted to share is how important it is to highlight that these things are not collateral damage. It's actually a tool of genocide. I can talk about Palestine experience, and I'm sure it relates to a lot of other countries with similar settings. Like in Palestine, one of the forms of medical apartheid is how Israel designed the medical system to be. So I can speak about oncology because this is my field, my research focus. So when it comes to oncology, the only comprehensive cancer center in Palestine is located in East Jerusalem. Patients living in the West Bank and Gaza, at least at a certain stage in their treatment and diagnosis, they have to be referred to East Jerusalem because it is where the only comprehensive cancer center is located. And then Israel denied radiotherapy in the West Bank and Gaza. So basically, any patient who requires radiotherapy has to be referred to East Jerusalem. And then at the same time, they required that anyone residing in the West Bank and Gaza wanting to go to East Jerusalem must apply for an Israeli permit. The process is complicated to say the least. A lot of patients end up being denied permits. A lot of patients end up with delays in their permits. And this is a tool of genocide. It's not a collateral damage. When you design the system this way, when you are denying patients access to the only facility that provides them with the treatment, you're basically killing them. So Israel has been killing Palestinians not just by bombing them, not just by shooting them, but also by denying them access to treatment, by denying them access to diagnosis. And it is our mission to talk about this. If we don't address this in this exact way, the way it should be addressed, then there's no point of it. It's like putting a Band-Aid on a bleeding wound, on a very deep bleeding wound. It wouldn't solve the issue. And this is why addressing the root cause of the problem is essential. And it has to come from us who have this comprehensive understanding of the situation and who are always willing to address things the way they should be addressed and to talk about things the way they should be talked about without softening the language and trying to maintain a neutrality. So thank you all.
No, thank you so much. Thank you so much, Dr. Muharib. I believe it's quite important, in terms of we are in a very, let's say, bright time in terms of talking about like our different causes together as like Middle Eastern. One of the drawbacks that we are currently facing there, it'd be maybe like my opinion gonna be like a bit controversial, but I believe like having the enemy from within is actually hindering the aspects of us communicating the information that we really aim to share with the world in a proper way, and also like uh, unfortunately hindering our joint agreement. I mean, internally to unify our voices against like the different basic principles of human rights that the people of our region are currently facing. What also I wanted to highlight, which is quite somehow worrisome, is the aspects of brain drain. Most of the people who are currently well educated are not, let's say, located on the area that they're supposed to be in, which is, I can look at it from a two-way perspective, let's say, because right now people like you currently are located where their voice is going to be heard, which is quite amazing, you know, at Harvard, where you can say, you know, um, your cause in a way that could be like well heard. Adding to that also, you are somehow empowered with the different like tools and basic principles that gonna give you like the aspects of communicating your cause not only in a way that could be heard, but also in a policy that could be adopted and treaties that must be enforced for the people whom are currently accountable for the different violations happening, and countries are doing like a proxy interventions to your country to your people. So linking between those different aspects is really important. Unifying our voices together, I believe it's very important. And building on the basic human rights principles is gonna always help us advocating for the different causes that we really aim to support. And just building on the story from the West Bank from Dr. Noura, is it's quite amazing how healthcare access could be weaponized against people and dehumanizing people, and if that also limiting the accessibility to healthcare in an ethnic way. So you can understand, you know, how politicized, you know, accessibility to healthcare and your global health intervention if you really aim to work on it. And it's not only, by the way, it's not only global, but it's also domestic. The different like inequality that you are seeing all around the world, you can also see it here from within. I mean, at the country that you are currently living in. So broaden your horizon on the aspects of looking at how health services are actually delivered is very important way of securing your cause as a medical provider to support, you know, the people and provide them like a healthcare, quality healthcare with dignity and respect. Over to you.
I feel like something else I've been thinking a lot about has been like the deliberate attacks on healthcare, whether it's like on like Palestinian doctors or nurses, or just like the sieging of hospitals, which like if we like sat here and imagined like an entity sieging Boston Children's Hospital and like shooting physicians while they're performing surgery, is just like an insane concept to me to like even let that reality sink in. And there's been also like some talk about how there's like so much repression and not a single US like organization has like even mentioned or talked about this at all. And I guess like this goes back to Noor's question earlier. It's like, what can we as like medical students do beyond like creating spaces where we can talk about these issues and just like feel shame about like the insane hypocrisy that there is at institutions like ours?
I'm gonna merge my question with Fatima's question, which is the attacks on healthcare, but also I want to put it in the context of the loss of credibility of all of these agencies and the loss of credibility of all of the humanitarians who are actually going there and doing the work, meaning that there is complete disrespect of any semblance of humanitarian law. And that to me is the scariest issue here, which is that even countries and entities that are sort of proponents and championing all of these laws and these regulations are now becoming so like they are completely disregarding them. So there's nothing that holds anyone accountable anymore. And so I was actually reading, I think there was an article yesterday about the Sudanese women who are now in Chad getting raped and being survivors of gender-based violence by people who are claiming to be MSF providers. And so that to me is adding to the issue even more, because now you're having people not only in good faith going there and trying to do good work and getting attacked, but also people using the status that used to be protected to actually harm. And so right now, I assume in your line of work, Dr. Hamida, like probably your colleagues, there's no such thing as protected status anymore. You could be wearing a vest, you could be wearing whatever the hell you want. You'll still get attacked because there's no respect for these regulations anymore. I would love to hear your thoughts about that, about the experience of your colleagues, your own experiences perhaps, and where do you see this going? Because it is so horrifying to me.
So, unfortunately, the aspects of lack of information directly linked to the accountability element of what you just mentioned. So, most of the violations that is currently happening in the two different conflict parties locations, I mean specifically about from the rapid support forces, are actually unfortunately regionally supported, and which is really disgusting. It's directly linked to the overall global agenda that must be enforced in Sudan in a way that has no shame, no regret for those countries at all, because of mainly controlling the natural resources that this country has. And they are saying it, Sudan is too big for them to control. So you can hear like such language is directly somehow protected from the supposedly, global policing through the UN agencies and different like UN Security Council events, which is really what the least I can say. It's actually disgusting. And what we are currently doing is directly replying to your question, responding to your question in terms of utilizing different routes that in a way that will not directly link us to those international actors, but give the power for people, because at the end everything is local. And one of those like fueling mechanisms that those proxy actors were utilizing prior to the war. I just don't want to mention like too much history, but those proxy actors were manipulating the aspects of providing like a specific narrative that will make us somehow indecisive towards those two conflict parties. And unfortunately, also they sabotage our leadership, political leadership and different elite parties in a way that made us like disruptive and somehow divided on where the fault is actually on which conflict parties. And we are also neglected, unfortunately, as a nation, the aspects of unifying ourselves in at least, the main basic humanitarian principles or human principles, is just to protect civilians, to protect our people. And they made us like somehow have like a grudge against ourselves and also killing ourselves, because if you looked at this conflict from our side, is actually between two Sudanese people. They call it like a civil war, which is actually not. It's a war that has been fueled by proxy actors for like long-term plan for this country to be divided. So fighting such narrative is quite hard because unfortunately it's a country-based support with a huge amount of resources and controlling also the different like media outlets and social media streams, and made our work is quite very hard. Why? Because the different violations that I'm just currently mentioning in my presentation is the tip of the iceberg. It's only mentioning like the kind of information that we have. You are talking about more than half of the country right now doesn't have accessibility to internet, doesn't have accessibility to telecommunication services. So you can imagine the amount of violation that no one heard about, and unfortunately still protected from the UN Security Council in a way that, as I just mentioned, disgusting. But just to again highlight the aspects of the importance of local movements, again, is this. The unity is very important. Understanding the basic elements of protecting civilians is very important, especially for the young generations, because it's a long-term, unfortunately, it's a long-term fight that we really forced to have with those international actors. I hope I somehow answered the question. There is no like direct answer for it, but what we are trying to do is just to mobilize the local effort that we somehow able to provide. And you can see like also the dilemma that we have as humanitarian actors right now. Unfortunately, we also, which is against the international humanitarian law, the aspects of impartiality. We can't be impartial because we are the victim here. So we must like put and all we can also like be neutral because putting the different conflict parties accountable to their violations is a must, and also providing or generating the evidence needed is a must for us to do. But we are trying our best also to balance between this and our job in terms of finding like mutual agreement with both conflict parties to provide services in their different like territories as much as we can, which I do believe like we managed to somehow do because of our reliance on local actors. So we are not deploying any medical providers, for example, or any healthcare providers or food providers from outside. We are relying on the local actors and the local communities that we have already strong ties with, support them and empower them with the resources that they need. And also we are trying our best to gather information from them to speak on their behalf about the violations happening on the different locations that they on the different like atrocities or the different attack that they faced. I mean, as a tribe or as a village, as much as we can.
Thank you. Yeah, I think like shifting the relying on like outside help and aid and what you were talking about to actually people who are there locally, who understand the circumstances, who have like a strong grasp of what's going on. I think that's where we're maybe headed more towards right now, and no longer expecting people to have any semblance of respect to what we describe as like international humanitarian law. If people need to leave, please go ahead, but maybe we'll keep Dr. Hamida for a little bit more. We can.
Yeah, I have the whole night for you. And I believe like it's a very thorough discussion, let's say, which could be followed with other events, yeah, in the future.
Yeah, I think we definitely need to have you back and hopefully in person next time. I think we haven't even scratched the surface of what SAPA has been doing and what's been going on in Sudan. And also, I think things evolve quite quickly. And I feel like the next time we talk, those numbers are gonna change dramatically, unfortunately. But thank you so much for speaking to us. I don't know if you have any final words of wisdom to the students who are here. Most are first year, second years, medical students and dental students, and then some have finished their training as well.
I really don't know what to say. So I just wanted to highlight that my story was actually started in University of Jazeera, which is the second biggest medical school in Sudan, around 300 kilometers from Khartoum, and it's community-based faculty, which unfortunately has been massively besieged by this RSF Rapid Support Forces, UAE supported militia. And I just left like 2 days before the war. I really don't know how I managed to be here, but I was hoping for a prosperous future for Sudan, and yet I feel like I am right now forced, let's say, to speak on behalf of my people in different events like the one that you just invited me in, and it's very hard, to see the scale of this crisis. The numbers are not speaking quite loud, but you can sense no Sudanese has not um, affected by this crisis, either directly or indirectly. I mean, even the diaspora has been massively stretched to support their families whom has been displaced or sought refuge in nearby countries. So you can imagine the amount of disaster that the Sudanese people are suffering from. But you can also understand the pool of support that medical providers from a Sudanese nationality are currently doing to secure the healthcare services to their people, but also speaking on their behalf on the different advocacy corridors as much as possible, and also trying the best possible to generate evidence to put the different conflict parties accountable, and also the disrupted global system accountable to the humanitarian system accountable to the negligence of this crisis. And from this story, you can understand the amount of change that you are well positioned to do in the world. You are right now representing one of the top universities around the world. You have the different knowledge and expertise that you really need to change, how healthcare is actually delivered. And you also understood, the aspects of healthcare is not only delivering services at hospitals, but it's way more bigger than this. And the different researches or the different let's say evidence that you might generate out of your studies could change the way how those services are actually delivered, not only in your context, I mean in the health system that you are serving in, but also could enhance the accessibility to care all around the world, especially in the disrupted and politically fragile context like ours. So just keep the momentum of bright future and believe in yourself, because you are really in the best position to change, how the health services are currently provided all over the world, and the humanitarian services are currently provided. So yeah, I don't have any more thing to add, but I believe Dr. Muharib is quite more, let's say, well positioned to provide what you need. And of course, if you are interested about doing some work in Sudan, we are more than happy to support you with that, and provide any kind of facilitation that you really aim to have, let's say, to support us even generate evidence out of this neglected crisis in Sudan.
Yep. Thank you.
Thanks, everybody.
Thank you, Dr.
Thank you so much.
We're
Thank you
gonna
so
stay in
much.
touch. We're gonna
Of
stay in
course.
touch, I promise. Best
Have
of
a
luck
great
with
night.
everything you do. Thank you.
Bye.